Hello, my name is Juliana Hagembe, a public health leader focused on strengthening access to diagnosis and care, particularly for women whose symptoms are often overlooked. Today, I'll share my leadership project on digitizing screening to improve identification and referral of women and girls with bleeding disorders in Kenya. In Kenya, many women silently endure heavy menstrual bleeding, which can be a key sign of an underlying bleeding disorder, such as von Willebrand disease or hemophilia, which can be effectively managed if identified early. Globally, 1 in 10 women experience heavy menstrual bleeding, and up to 20% remain undiagnosed, often for years. Earlier last year, I worked with a small interdisciplinary working group to adapt a facility-based checklist for non-clinicians and also design the plan for a CHW pilot. The goal was to move screening beyond health facilities and into communities where women face fewer barriers and can be identified earlier. The resulting PEPPER checklist is very practical and easy to use. However, it cannot capture data in real time or track referrals effectively, which limits its impact as screening expands. This creates a clear gap. To scale identification and strengthen referral pathways, the checklist requires digitization. My project entails digitizing this checklist into a responsive, web-based tool that CHWs can use on either their phones or computers. Digitization will make screening easier to administer, strengthen referral pathways, and generate real-time data that can support earlier diagnosis and care for women at risk. Importantly, this approach builds on an existing tested tool rather than starting from scratch while preparing it for scale. Over the last few months, I've focused on building a strong foundation for implementation. I completed a full theory of change, developed a stakeholder map, and drafted an implementation plan and monitoring framework to prepare for piloting. I also created a concept note and elevator pitch to support resource mobilization. An immediate result is that early feedback from the paper checklist indicates it's easy to use and supports identification. The current challenge is securing funding to design and develop a CHW-friendly digital checklist, which is the critical next step in moving from paper to scalable data-driven screening. The implementation plan is phased and realistic. Planning is complete and donor engagement is ongoing. Next, I plan to form an advisory group and begin user-centered design, followed by prototype development and testing. This will be followed by CHW training and pilot preparation, leading to a pilot launch with integrated referral tracking. The expected outcome is improved identification, stronger referrals, and better data to inform decision-making and care. This project has strengthened my strategic and inclusive leadership by pushing me to balance vision and practical implementation realities. It reinforced the importance of designing solutions that work for frontline users while staying focused on impact and skill. Most importantly, it reinforces my commitment to equity, dignity, and voice for women, ensuring their symptoms are acknowledged and acted upon. I welcome collaborators and supporters who share the vision of early detection, digital innovation, and advancing gender-responsive care. Together, we can transform how bleeding disorders are identified and managed in Kenya and beyond. Thank you.